Did you know that being homeless actually increases the chance of reducing your life expectancy? Now, this makes sense because they often don't have their relatives around them to care for them. They have limited access to public health care and don't even have insurance to access that health care. Now, as fellow staff and our students of Santa Ana College, it should be no surprise to you to understand how common it is to see homeless people around our city and other parts of Southern California for that matter. And if this problem continues to happen, then we'll be indirectly contributing to the reduced health and lifespan of these homeless individuals. That is to say, if we do nothing, this problem will only get worse and worse and worse, and it will be essentially our fault because we did nothing. As a result, today I will be informing you on the extent homelessness affects its victims and those around them, a proposed solution to the problem, and ways to visualize how we can implement and execute this in an orderly fashion. Now, according to the City of Newport Beach website, the federal government defines homelessness as a condition in which an individual or family lacks a fixed, regular nighttime residence and instead resides in a public or private residence that is not designed and or intended to be a regular sleeping accommodation for human beings. Now, this is important, especially in California, because according to a article published in March 2022 on the Guardian website, it was reported that 70% of the state's homeless population is unsheltered, compared to New York, for example, where only 5% of the homeless population is unsheltered. Now, what is causing this problem? It could be a couple different things, right? A lack of available and diverse opportunities for these homeless people to become employed, as well as the rising cost of living, especially here in the state of California, and or a lack of government aid. Who is the primary target for this problem? It could be single adults, as well as other families, children, and younger adults who are already in the lower working class and going through and living in these conditions. As for why this problem needs to be solved, it's contributing to the breakdown of communities, of families, and overall of the way society is supposed to function in its proper way. Now, there are 4 different solutions to homelessness that I would like to propose. The first being rehousing, rapid rehousing, in which homeless are helped in finding housing, paying for housing, and staying in housing. A part of this first solution is also permanent supportive housing, in which homeless that are disabled are catered to specifically because they can't take care of themselves. The second solution I would like to propose is learning how to prevent it in the first place, right? If we could look and see where homelessness develops and eliminate it at its source, then we could be saving a lot of damage that would happen if we did nothing at all. The third solution I would like to propose is to build career pathways to help homeless as they transition from now being in housing to becoming independent, right? As we all know, living costs money and they need a job to do that. So if we can transition them well and in such a way to where they don't fall back, that would be ideal. The fourth solution I would like to propose is schools becoming more responsible for the well-being of their students as they grow up, because, like I said earlier, if we can eliminate this problem at the source, then we'll be saving so many more people in the end. As for the visualization model, what can we do? What would happen if we implemented some of my solutions? Areas and communities where the homeless people are currently inhabiting, those areas would likely go back and resume their usual functioning, right? Because wherever the homeless are, it's usually a disruption of whatever was going on in that area. But now that the homeless have left or are not there anymore, then prior functioning can take place. Additionally, costs of healthcare could be reduced. There'd be less hospitalizations, and the taxpayer money that is dedicated currently towards the resources for homeless people could be shifted to other more pressing matters. Now, conversely, we have to look at what would happen if we didn't implement some of my solutions, right? There'd be an increased rate of substance abuse. More and more people would go to jail, and communities would continue to be less safe. And especially after these past 2 years, if we face another global threat like the pandemic, then the homeless are going to be one of the first groups to suffer as they are the least prepared. Now, in conclusion, the initial steps to ending the problem of homelessness are to provide immediate housing, education, and stabilization programs exclusively in that order to even begin seeing process. Now, for us, this begins with raising our voice, especially to elected officials, right, during times of elections. So if we can do our part, bring this issue of homelessness and really address it and put it on on a national level for them to understand, then they'll see how important it is and take action immediately.